Good evening, Anne.
How
How
are you
is
today?
your? Yeah, I'm good. What about you? How is your weekend?
Yeah, um, I'm good too,
Uh,
and
yeah.
yeah, Lion. Um, no special thing.
Mm, okay. So
Yeah,
you do a lot of things, right?
yeah,
Yeah. Okay. So are you ready for our lesson today, Anne?
yes,
Yeah, very
I'm
good.
ready.
So let's proceed with our lesson now. I hope you can see the presentation. Can you see it?
Yes, I can see it.
Yeah, very good. So before we have to proceed, before we have to listen to Dr. Vasquez diagnose three more patients, and after that one, we have to complete the chart. But before that, let's try to have a review first of our lesson last time, right? So in understanding the doctor's instructions, so how are we going to do that one, Anne? how do we how do we understand the doctor's instructions?
Mm, um, to
Of course.
understand the
Yes.
prescription.
Okay, the doctor's instructions. So we have to listen,
Okay.
right? Okay, that's just
Yeah.
only the key. That's just only the key. Let's say, for example, since you're a doctor, so do you think if you are saying something to your patient or to your patients, are they listening to you?
Yeah. Yes.
Yes, right? So
And
it's very
listening and
important.
understand. Yeah.
Yes, it's very important to listen. And then after that one, of course, you have to give them prescription, right? Yeah,
Yes.
that's why it's very important to listen very carefully to the doctor's instructions. Okay, and then if you cannot understand what the instruction of the doctors, so what are you going to do? You have to
I will
ask.
ask again. What? Yeah.
Yes. You have to ask questions because it's very important if you couldn't understand what he said. Okay? So do
Yeah.
not just pretend that, okay, yeah, I know. Okay? But when you come home, you don't know what to do, right? So instead of your sickness will be cured, so what happened? It will not going to work
Yeah.
out or if you're not going to be fine because you didn't follow the instruction of the doc,
Yeah.
right? And
Yes.
okay, now this time or since you are a doctor, of course you have to tell your patients that, oh, you have to listen very carefully of the following instructions. It's very important, right? And
Yes.
okay, did you emphasize or do you emphasize that one to your patients
Yes,
that
of
they should
course.
have? Yeah. So what's the importance of that, Anne? Importance of emphasizing the instruction. What do you think?
Yes, I think it's very important. Sometimes, uh, always doctor always need to emphasize the emphasize to the patient, and then um, check what they understand, or
Okay.
the patient really understand what the doctor say.
Yes. Okay, very good. Okay, so it's very important, right? Because sometimes person might forgot, right? So they might forgot when they come home, they already forgotten what the doctor said, right? So it's very important to give them also a prescription, right? It's very important also to write everything. Like for example, take paracetamol every 4 hours. Okay, you need to go to the, let's say for example, laboratory for another checkup. Okay, so you have to write them
Yeah.
because if you are just going to tell them, they might forget that one, right? And
Yeah.
Yes, okay.
Yes.
So for our new activity today, we have to listen to Dr. Vasquez diagnose three more patients. And after that, let's try to complete the chart. Okay, try to
Yeah.
listen.
Yes.
47. Okay, it's there.
Recording 47. Patient 1.
You have a chest infection, I am afraid.
Oh dear. Really? Are you sure?
Yes, I don't think it's too serious, though.
Thank goodness for that.
Mm.
But you will have to take some antibiotics. Take two twice a day, once in the morning and again at night for 5 days.
Okay, it's very important, right? And so this
So
is
sorry,
how,
teacher, but
yes,
I have some problem. I
problem.
can
Ah,
hear
okay,
because it's not maybe some
some problem with
internet connection.
connection. Okay, can we listen it again? Okay,
Yeah.
Patient 2.
we have to listen it again,
Well,
right?
The
Okay, wait for a while.
Recording
sound
47.
Oh,
Patient 1.
can you hear it?
you have a
Can you hear that
um
one?
the sound is interrupt not fluent.
Slowly, something like that. So there's a glitch. Okay, there's a problem connection, right? Yeah. Okay, so let's try again on. Okay,
chest infection, I am afraid.
can you hear
Oh
that?
dear. Really? Are you sure?
Yes, I don't think it's too serious, though.
Thank goodness for that.
But you will have to take some antibiotics. Take two twice a day, once in the morning and again at night for 5 days.
Okay, have you heard that, Anne? Hello. So it's a problem with the connection. Hello. Can you hear me, Anne? Hi.
Yes.
Yeah.
In a short while I can hear
Oh
no sound.
yeah. Yeah, actually,
I don't
okay.
know the problem for me or in for in your con in your connection or my connection.
Yeah. Actually, my connection is good. Yeah.
You can you hear me clearly?
Yes, I can hear you clearly. Okay. What about me? Can you hear me also?
Yes, now I hear you,
Yeah. Okay, let's try.
but
Let's
not
try.
very good. Yeah.
Really? So maybe there's a problem with the connection, right? Okay. So can we try to hear them again?
Yes,
Yeah.
I can.
Okay. Let's
Let's
try.
try again.
Yeah,
Please.
let's try again. Okay, just for a while. Okay. I hope you can hear this
Recording
time.
47. Patient 1.
You have a chest infection, I am afraid.
Oh dear.
Okay. Let's try to answer first, huh? According to Dr. Vasquez diagnosed patient number 1, she has what she has? She has a chest infections, right? And according to Dr. Vasquez diagnoses the first patient has chest infection. Okay. Okay. Now, this is very, very important, right? And it's very important to understand. Okay. Since you have an infection of the chest, it's very important to understand the instruction very carefully, right? And okay, can you hear me,
Yes.
Anne? Yeah, okay. Now, what's
Uh,
the
uh,
instructions?
let me sorry, I can hear clear. Clear.
Yeah,
I
okay.
can I you my
Yes, hello?
can Yes. Now I can hear you.
Yeah, can you hear me now clearly?
Yes.
Yeah, okay.
I view my telephone,
Yeah, okay.
my mobile phone. Yeah.
So you transferred to your mobile phone.
Yes.
Yeah.
I listen to through my microphone and I see.
Yeah, okay. So you can hear them. You can hear my voice clearly, right?
Yes. Is
Yeah,
it
very
okay
good.
now?
Yeah, okay. So can we try to listen it again?
Yes,
Yeah,
please.
okay.
Sorry about that.
It's
Recording
okay. It's
47.
okay.
Patient 1.
You have a chest infection, I am afraid.
Oh dear. Really? Are you sure?
Yes, I don't think it's too serious, though.
Thank goodness for that.
But you will have to take some antibiotics. Take two twice a day, once in the morning and again at night for 5 days.
Okay. So what are the instructions of Dr. Vasquez to patient number 1 since she has a chest infection? So she will be going to take antibiotics, right? So
Yes.
the instruction would be she will going to take 2 tablets,
A day,
yes, twice, okay,
twice a day
twice a day for how many days?
for 5 days.
Yes, that's correct. So for 5 days. Now, this is what I'm trying to emphasize on, right? That
Yeah.
as a patient, okay, it's very important to listen to the instructions very carefully, right? Okay,
Yes.
but as a doctor also, of course, you need to give also your patient the the things that he will or she will be going to do at home, right? Because sometimes as a patient, we forgot everything, right?
Yes.
Okay. So that's why it's very important to have this one, right? That's why in a doctors, okay, a doctor has this particular there would be a sign called, what's that sign if you're a doctor? You have a paper that has RX, right? And
All right.
yeah. Yes, an RX,
Yeah.
right? Because RX means this one is a symbol for doctor, right? Okay, that means it's a prescription.
Yeah.
Okay. Okay. I when just like this one of the example on during the checkup of my child, okay, we went to a pediatrician, okay, to a pediatrician, and then our pedia always put like this, okay. I don't know if you encounter this particular symbol. Okay, she said this one, okay, and then put like that, okay, and then put like that. So according to her, okay, let's say for example, take one one medicine in the morning and take one medicine in or one paracetamol, let's say, in the lunch, and take paracetamol in the evening. So
Evening.
she put that one like that, right?
Oh,
Okay,
yeah.
so for the patient, okay, for us the patient to understand the instructions very carefully, because if we might forget how many times a day that we need to take, so what would happen? So our condition will going to get worse,
Yeah.
right? And okay,
Yeah.
next, let's try to listen to patient number 2.
Patient 2.
Well, I think you have a mild case of asthma. It's
Okay. So case number 2 or patient number 2 has a mild case of,
Asthma.
yes, asthma. Okay. And then let's try to listen to the instructions of Dr.
not too
Vasquez.
serious, so don't worry. But I want you to use an inhaler whenever you feel short of breath. Come and see me next week and we'll see how you are.
Okay. So whenever he has this particular thing, so he or she will going to use an,
And tablet.
okay,
Ah,
inhaler, right? And
Oh,
yes, so inhaler. And then Dr. Vasquez advises, okay, the patient number 2 to come back
next week.
next week. Okay, good. So come back next week. Okay, next. Patient number 3.
Patient 3.
I think this is a very bad cough.
Mm. So patient 3 has a very bad
Cough.
cough. Okay. Okay, let's try to listen to the instruction.
I will prescribe some strong cough medicine. Take 2 spoonfuls every 3 hours. It will make you tired, so don't drive. Come back in 3 days and we'll see if you are better.
Okay. So according to Dr. Vasquez, since the patient number 3 has a very bad cough, he instructed, or yeah, patient 3 to take
Mm,
2,
2.
yes, so 2 spoonfuls every,
3 hours.
yeah, every 3 hours. And don't, okay, he
I
advises
keep
also don't drive, right? Because it makes the person
right.
dizzy, right? So
Oh, yeah.
therefore, according to Dr. Vasquez, don't try because it makes you dizzy, right? Because those who are those who are taking medicine for cough, right? And so there would be
Yeah.
this formula that makes us dizzy. Okay, so don't
Yeah.
drive, and then after that he advises also the patient number 3 to come back
In I
in
can I
in
can
also 3 days, right?
yes.
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 So after 3 days, so Dr. Vasquez advises the patient to come back after 3 days. Okay, and now
Yes.
these are these are very important, Anne, right? So as a doctor, you need to have this actually to your patient so that when the patient came home, I have to take 2 tablets a day for 5 days, right? So it's easy for the patient to understand. Sometimes there would be a lot of medicines that a doctor will
Oh,
go
yeah.
to prescribe, right? Sometimes not just only one. Sometimes it's five tablets or five,
First,
yes,
don't
five
remember.
medicines, right? So if you don't have this particular schedule or instruction, so I might as well. I'm going to take the one at a time, right? So five medicines, right?
Yes.
Okay. So it's very important. Why? Because if you will not going to give these instructions to the patient that is written, okay, it's very important to write this one, right? And not just
Yeah.
only saying them, but you need to write them, okay? Because if the patient take this, let's say 5 medicines, and then after that one he overdosed it. So what would happen to the patient? So the patient might risk his or her life, right? That's
Yes.
why it's very, very important. Okay?
Yes.
Okay. Next. Do you have questions with this, Anne?
And no more.
Okay. Let's
And
try to practice this one, Anne. Okay. Supposing, okay, you are a doctor. Okay. So you are going to diagnose me that I have a chest infection. And how are you going to instruct me? So let's try to dramatize this one, Anne. Okay. So you are a doctor. Okay. So what are you going to do? Oh, good evening, doc. Yeah, so
uh,
you're a doctor. Good evening, doc. I'm a patient 1, okay? So you are going to tell me my diagnosis, okay? Okay.
yeah.
Good evening, doc.
Good
Oh,
evening.
yes. You know what? I have um hard time breathing. Okay, as if my chest is aching. So what do you think would be my condition?
Um, Maybe you have a chest infection.
Oh my God. Okay. So is this what is one? Is this a serious condition, doc, or not?
Um, not very, not
Serious?
very serious, but
Oh, oh,
I
yes.
will give you a prescription, and you have
Okay.
to follow um
Yes.
follow
Yes, I
the
will, doc.
prescription.
Yes. Okay. So what are those instructions or prescription that you need to give me, doc?
Yes. You need to use some antibiotics. I will. Yes. And
Yes.
you need to use antibiotics.
Yes.
And,
So
you use it two tablets twice a day for 5 days,
okay.
and
Um. Okay. And
and in 5 days. After 5 days,
okay. And I have to repeat this one, doc. If I heard it correctly, okay. So you are going to give me an antibiotics, which I am going to take 2 tablets twice a day for 5 days. Is it correct, doc?
yes,
Okay.
you're correct.
Yeah. Okay. And then when am I going to come back for a
After five
checkup?
days,
Okay. So after 5 days, I have to come back to you for another checkup. Am I right, Doc?
yes,
Yeah.
that's
Okay.
right.
Yeah. So thank you so much, Doc.
Uh, uh, see you in the
Yes. Okay. See you after 5 days,
day.
Doc. So I have to follow your instruction. Okay. Okay. Now another
You
patient.
better soon.
Yes.
I hope you will better soon.
Again.
I hope you will be better
Yeah,
soon.
sure. Yeah, I hope so. Okay. So maybe the tablets that you were going to give me will be very effective, but I should have to follow. Okay, I should have to follow the instructions, doc. Okay?
Yeah,
Okay. Okay. So thank you so much and see you after 5 days, doc.
yes.
Yeah. Okay. Now let's try to do patient number two on. Okay. So
Hello. What
doc, um
what
I
the
can't
problem
breathe.
you?
Yeah, I can't breathe. Okay, so what might be my condition, doc? I can't breathe. It's hard for me to breathe.
Yeah. You have my case of asthma.
Oh, okay. So is this serious case, doc?
Um. Yes.
Oh,
It is serious.
okay. So what am I gonna do, doc?
You need to use the medication. You need
Okay. So
to
what?
use the medication to
Okay.
control your shortness of breath.
Okay. And then after that one, doc.
Yes, I will use the inhaler,
Okay.
and
Inhaler.
you use an inhalers,
So
and
every time I had a shortness of breath, I have to inhale. Am I right, doc?
um
I have to use an inhaler. So every time that I have a shortness of breath,
you
so I have to use the inhaler. Am I right, doc?
yes, use the inhaler when you um feel difficult to breathe.
Yes, okay. And okay, so I have to follow that one, doc. Okay, do I need to come back, doc?
Yes, of course, you need to come back after 1 month next week.
Oh, next week. Okay. Yeah. So I have to follow the instructions that you gave me, Doc. Okay. So thank you so much, Doc.
Thank you and goodbye, patient.
Okay. Yeah. So patient number three. Okay. Ah, ah,
What the problem with you?
I think I think I can breathe also, Doc. and my throat is aching. So I have to consult with you. So what would be this particular condition that I have?
Oh, you have a very bad cough.
Yes, doc. So what do I need to do, doc?
Yes. You need to use some medication.
Okay.
Yes.
Yes. So
You
what
take,
are those medication, doc?
yes. Take 2 spoonfuls
Okay.
every 3 hours, and
Okay.
remember, don't drive
Yeah, okay. I'll
time.
follow that one, doc. Okay.
Come back
And
in 2 days.
in 3 days. Okay. So I will follow that one, doc. Okay. So why is it I'm not allowed to drive, doc?
Because the side effects of this
Mm.
medication it can cause you disease and
Oh, okay.
maybe um dangerous
Dangerous
when
for me to drive. Yeah, okay. Oh, very good. Okay, docs. Now I know because sometimes, okay, sometimes I feel dizzy also. Okay. Okay. Okay, so very good. Now you're a doctor, okay? You're a very good doctor because you can be able to prescribe a medication for your patient. Okay, so do you have questions with this, Anne?
I can diagnose just after one
Yeah,
one um
yeah. Actually, so
so
you need to have a lot
I
of.
don't ask more and I
That's
can
correct.
directly diagnose it.
That's correct. Okay. Okay. But we are just only practicing, right? Okay. But don't do this one, right? Because if you are going to diagnose right away that, oh, you have, so it's not possible. So you need to conduct a lot of questioning, then a lot of laboratories, right? And okay,
Yes,
laboratories, the result of the laboratories are very important before you can diagnose a patient, right? Okay,
yeah,
very good, right? Because if the patient would come to you and then he will just going to say, "Oh, I have a shortness of breath," and then you were going to say, "Oh, you have a mild asthma," but you weren't able to know the right cause, right? So it's very important also to ask, okay, for you to diagnose a patient. Okay, very good, huh? Now, imagine you are a patient of Dr. Vasquez. So listen and tick the correct statement. Put a cross next to the incorrect statement. So letter A, this one is wrong. You should take 2 tablets twice a day before meals. So what makes it wrong?
you should take 2 tablets twice a day. I after meals, I think
This one is wrong. So it makes wrong because of the word before meals, right? Okay, so what would be the right answer?
after meal,
Uh-huh. After is
or
it after meal?
twice a day for 5 days.
Mm-hmm. For five
Um,
days, right? So take 2 tablets twice a day for 5 days,
4 days.
right? Not before meals. Okay? Okay. What about letter B, Anne? You shouldn't drink alcohol, but coffee is okay.
Mm,
You shouldn't drink alcohol, but coffee is okay.
Encourage,
Huh? Okay, this is
encourage.
incorrect. Okay, let's try to listen after Anne. Okay, so what do you think would be that makes this statement incorrect?
I think coffee. Doctor often uh, advise patient not use coffee.
Yes,
Maybe
okay.
in some
Yes,
disease.
actually, because the same alcohol and coffee is not advisable, right? It should be avoided, right? And because coffee has a caffeine, right? Okay, that there would be reactions to some medicines, right?
Yeah,
And yes, same with the alcohol. Okay, next, letter C. You need to exercise more often.
more often.
Yes.
I think it's correct.
Yes. Okay. Then the problem should go in a couple of days.
The problems now in a couple days. I think it's correct.
Okay. The problem should go in a couple of days. Okay. And then you should start eating small portions of food.
Start is
Mm-hmm.
person.
Yeah. You
Uh,
should eating small portions of food.
I think incorrect. You should start eating.
Yeah. You should start
Food.
eating small portions of food.
Incorrect.
Okay.
Maybe
Let's try, huh? Let's try to listen after. You shouldn't drink alcohol or milk.
incorrect.
Okay. Okay. Now, let's try to listen now on if that would be correct.
Recording 48. A.
I think you are suffering from a migraine. I will give you a prescription for some tablets that are very good. Take 2 tablets 3 times a day before meals. It should be better in a day or two.
Hmm.
B.
Okay. So, what makes it incorrect?
3 a day.
Yes, 3 times a day.
Every
So,
day.
yeah. So this one is not twice, but 3 times a day. So this one before meals is correct,
Milk is
right? Yeah, okay. Next, letter B. Try to listen.
Well, I think this is food poisoning. You need to drink lots of water and avoid alcohol or coffee. Don't eat anything until you start to feel better. And then have simple food that is easy on the stomach, like rice and chicken. Oh, and have small portions.
Oh, okay. So this one is the continuation on, okay? Letter A, right? So letter A is this one. You should take 2 tablets twice a day or thrice a day before meal. So the problem should go in a couple of days, right? And
yeah.
okay. So in letter B, this one is so the patient is not told not to eat. Okay, okay, okay. Next, you shouldn't drink alcohol, but coffee is okay. So you should start eating small portions of food. So this one is correct, Anne, right?
Yes.
Yeah, okay. Because the diagnosis of the doctor is food poisoning. Okay?
Yes.
So that's why drinking alcohol and coffee, okay, is not good. Okay, and since it's a food poisoning, so you should have to start eating only small portions of the food, right?
Oh,
Okay. Next, in letter C, you need to exercise more often. So let's try to listen.
C.
For insomnia, it's often a matter of getting more exercise and
Okay,
avoiding eating too much,
correct.
especially at night. Don't drink alcohol and have some warm milk before you go to bed.
Okay, right? So this
yes.
one is correct. Okay, and
Yes.
okay. Okay, now, if you are the doctor, I should have to listen to you telling me this one. Okay, Anne, okay? So how are you going to advise me? So letter A, you have to say,
You should take 2 tablets 3 times a day before meals.
okay, the problem.
The problem should go in a couple of
Okay,
days.
couple of days. Okay, next, letter B on.
You shouldn't drink alcohol and coffee. You should start eating small portions of food.
Okay, and letter C on.
You need to exercise more often and shouldn't drink alcohol and have some milk.
Okay, very good. Okay, so thank you so much for this particular advice, Doc. So I have to follow your instructions. Okay.
Yes.
Okay, now moving on to our next activity now. Now, for the speaking, reacting to news. So, showing concern and relief, right? Now, sometimes it's hard for the patient to accept the conditions, right? And
Mhm.
okay, let's say, for example, on the part of the patient, me, okay, I already had been hospitalized for 4 months, okay, because of COVID. So on my part, and during the time when I was in the hospital, okay, and I do have a lot of what is one things that's put on my on my hands, okay, and then I do have a an oxygen on my here, so because I can't breathe, right? So during that time, so it's what is one it's hard to react, especially when the doctor uh goes to my room and check me, okay, as if I don't want to hear the doctor might say, because it's going to be what is one it's my heart is palpating, okay,
Mhm.
because
Yeah.
I think the doctor will going to say that I'm going to die. So that's what I think, okay, so it's a trauma on my part, right? So during that time, okay,
Yeah.
so as a doctor, it's very important to show concern and relief also, right? Because there are some doctors, but I don't know, because maybe that would be the way a doctor will going to say to a patient, so that the patient will going to accept that one wholeheartedly, right?
Yeah.
Okay. So it's very, maybe that's the way of the doctor to tell the patient right away. Okay. So the doctor will not going to use flowering words anymore. That let's say, for example, if the doctor will going to tell something to the patient that, oh, I'm sorry to say that you will just going to live only for 1 week. Mm. It's going to be very hurting, right? So if you
Yes.
heard that 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 thing to a doctor, so the doctor will just going to give you only 1 week. So that means my condition or your condition is very serious, right?
Yeah.
And okay, so sometimes doctors tell right away your condition, but there are also doctors that they show a lot of concern, right? Okay, now let's try to underline the expressions to express concern and relief, right?
Yeah.
Okay, now Dr. Vasquez, you have some sort of virus, I'm afraid. Then
Right.
the patient, oh dear, really? Are you sure? Dr. Vasquez said, yes, I don't think it's too serious though. The patient, thank goodness for that. Okay?
Mm.
Now, let's try to, you have to, what is what? You have to examine the conversation of patient and the doctor. Okay, and now,
Yeah.
write C for concern or R for relief next to its expression. But before that, in this particular conversation, which do you think would be the expressions that the doctor showed concern and relief to the patient?
Mm, yes. Uh, I don't think it's too serious.
Okay, very good. So I don't think it's too serious though, right? So that is showing concern and relief. Okay.
Yeah.
Now, what if your condition is too serious? So what are you going to say as a doctor on? Since, let's say, for example, my condition is very serious. So how are you going to tell me that?
Oh, oh my God. Uh, oh dear. Oh dear.
Okay. Yes. Oh,
Um,
here,
oh,
your condition.
you sure? Really?
Okay. But let's say, for example, if my condition is too serious, okay, is it okay to say that I'm so sorry, but your condition is too serious? Is it okay to say this one to the patient? And
Yes, I think it's okay.
yes, okay. Why? Because if you will not going to tell the truth to the patient, right? So it's that good. Okay? So as a doctor, sometimes actually being a doctor is not an easy task. It's not an easy job, right? And
Yeah.
because you don't need to what is one? You don't need to keep it a secret. Okay? If the patient is going to die, you have to tell the
Yeah.
patient that he's going to die and he's just going to live only for 1 month, for 2 months, or for a year, right?
Yes.
Okay, because if the patient has a tumor, oh, you need to explain to the patient that he or she has a tumor, and that tumor is a cancer already, right? So if you will not going to tell the patient about his or her condition, and then if it is getting worse day by day,
Yeah.
so who's going to be blamed? The doctor,
That's right. Yeah.
right? And so the patient will going to blame the doctor. Why? Because the doctor wasn't able to tell the patient's condition. Okay?
Yeah.
Or sometimes it's the on the part of the doctor it's very hard. Okay, let's say for example, if the patient's condition is getting worse and he or she has to live only for a short period of time. Okay, so the doctor right away we're going to call the relatives of the
Oh, yes.
patient,
Relative.
right? And the relatives of the patient informing the relatives that your patient is having a very serious condition,
Yes.
right? Okay, and
The
then
ways indirect to inform for
yes,
the the indirect way to inform
yes,
the the condition.
yes, of the patient, right? Because sometimes if you will going to tell that one to the patient, so the patient will going to lost hope already. Okay, so the correct process on how to say the condition is to report that one to the closest family or to the
Yeah.
relatives of the patient, right?
Yeah.
Okay, and it's up for the family to inform the patient, right? And okay, so actually, it's going to be very, very what is one uh hurting hurting to the part of the patient, hearing that he has a very bad condition, right?
Yeah.
Okay,
And
but as a
often
doctor,
in in um in some case,
yes,
I in the case that the patient have a serious condition,
mm,
I often tell the relative
relatives, very
patient
good.
first,
Yes,
then maybe the relative will tell to
the
the patient.
patient, yes,
After that, I the patient asked me again, and I think this time is
you have
easy
to,
to to
yes.
the patient more.
Yeah, that's correct. Wow, very good. Oh, that would be right thing to do, right? And I know doctors' work is not easy. Okay, it's not easy, especially to say, for example, since you are an ophthalmologist, right? So there are a lot of conditions that a patient is hoping to see something, right? But sometimes their eyes is already in damage, okay,
Yeah,
so sometimes they will be only given a chance or a time that after that particular baby time their sight, okay, will be lost and they will become blind, right? And
yes,
yeah, so it's also very what is one your work as an ophthalmologist is not also easy, okay? Because there are a lot of cases that they have a problem when it comes to their sight, okay?
yeah. I
Yeah.
I have made a lot of people, a
Pe-
lot of patient
mm,
when the doctors explain their condition that
mhm,
the the uh, uh, doctor have no way to make they
yeah.
own, and they cry before
Yes,
her. Yeah. Uh,
actually. Mhm. Okay. And as a doctor, you will not going to show them that you also cry, right? So
yeah,
you need to show to the patient that you are something like you are tough, okay? But sometimes it's going to be very very touching also, right? On your part as a doctor because you say you see your patient crying in front of you, right?
it's
Especially,
difficult to tell uh, to,
yes,
to tell for the patient that the doctor can your
yes,
match your condition better, or
that's
I can
correct
do anything, or
for
you can
them.
see again. Yeah,
Yes,
it is
yeah,
difficult to say that.
that's correct. Because sometimes patient, especially let's say for example, it's a blind patient coming to you, and then they're hoping that you can do a magic for them in order for him to see again, right?
Yeah,
Okay. So his or the family, the patient is hoping, right, that you
yeah,
can do a magic. Okay, but you're not God. You are just only
yeah,
a doctor, and then you will going to say only to the family and to the patient that I will do my best, right? I will do my best, but of course, okay, if it isn't possible, we cannot do something about it, right? And
yes,
yeah, yeah. So that would be so as a doctor, it's not an easy job, okay?
yeah.
It's not an easy job. Okay. I
And
understand that
I think
also.
uh, with um for you, uh, psychologist.
Yeah,
Psychologist.
yeah, psychologist,
Uh,
yes.
I think a lot of case you cannot explain the you cannot uh, say just directly the
That's
diagnosis to the patient
correct.
have
Yes.
no problem because actually my sister he has um, mental di-
Condition.
yeah
Oh,
and
okay.
yeah and he
She was already diagnosed.
yes she have
Okay.
diagnosed for um, maybe 7 years and
7 years already. Okay. But
and,
she undergo a treatment already.
yes
Yeah,
she
good.
take the medication
Medication. Yeah. For seven
every day.
years. Okay.
Yes, by 7 years. And
Oh,
actually,
is it
um,
because of depression? Is she having she
uh,
was depressed?
not depression, but I think it's a more serious diagnosis. But I don't know the name of the diagnosis. But
Oh,
the the medication rest rest what um now we he uh he is the the it's damaged her her feeling and
oh,
he he can't he can no he can work now he
oh,
can work before
yeah.
yeah and
She can't.
she always feel sad and
Oh,
but not sometimes he think the way she think is wrong. It's
oh,
not like normal people.
yes, yeah, yeah, okay.
Um, mm, and now
Now she's okay.
she no, she's not okay
Ah,
because um not only not only just depend on
the
the medic
medication. Yeah,
is yeah and he's your her her condition is
getting worse.
getting worse
Oh,
because he cannot um um communicate
oh, okay. So
um,
she already lost communication.
uh yes he she still can um communication but she always she lie alone and
Oh,
can concentrate to
yeah,
the story that the people are saying.
yeah.
The
How old is your sister?
um he she thirst 37.
37. See,
Yeah.
she's older than you.
Uh,
She's older than you.
yes.
Yeah,
She
okay.
the third sister. Okay.
Yeah,
Yeah. I
yeah,
have
yeah. The
one
eldest.
sister
So
and
the
I
eldest. The
youngest.
youngest. Yeah,
And
okay.
this her condition uh fear turn uh guess word
Yeah.
in the time at the time of COVID pandemic.
Yeah, yeah, actually.
Yeah,
Okay.
and I think now it's important to her I need to find the I think the uh the important is the in, environment.
Environment, yeah.
Yes.
Yes.
The family.
Yes,
Uh,
support. Okay, family support is
family,
very important also.
yeah. But
Yes.
actually, my family, um, I think cannot do that.
Why?
Mm, because some problem with her. If it's difficult
Difficult. Yeah.
to adapt it with sometime with hurting.
Yeah. So she's also now he's this particular sometimes she also hurts people. She hurts people also.
Yeah, she always she often he easy to angry,
Yeah,
and
okay. So
when
she bursts
someone
out right away.
tell
Yeah,
her yeah,
that's
and
right.
yeah, our pupils my family always want to tell her, to remind her,
Yes.
uh, to caution, to pay more
Yeah,
attention for
attention to her.
what
Yeah.
we do, what she do, but that made he angry, and
Yes.
yeah, and
And start to yeah, and start to become unruly again, right?
yeah, and
Oh, okay.
something as often that's she often usually feel sadness when
Yeah.
at even in her birthday, or
Mm,
in some occasion that's
yeah.
one happy,
Yes, but she's not.
but she not. Yeah,
Mm,
and we always to uh, try to match a lot of uh,
yeah.
occasion that people can crowd this, and
Mm,
tell the 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 what
mm,
um, make he happy, but
yes.
it is um too difficult. Yeah,
Yes.
and she because in the past he he um, he works for software, and he get a lot of money, but
Oh,
before but because of her
her
disease,
condition.
he
Yeah.
not do anything. Um, so she always think about the money.
Yeah.
Um, yeah, she don't she cannot um she always overthinking.
Yeah. Yeah.
Sometimes,
Okay.
and often he cannot control her thoughts.
Yes.
Yeah.
Yes. Okay.
And he always tell about the past, but
Yes.
concentrate the current and future, but always uh, on we on story she told often the something he remember the past.
The past.
Yeah,
Yeah. She keeps on going back to the past, and
yeah,
that's a sign of depression.
yeah,
Right? So that's a sign of depression because she wanted to think of the past, and she cannot do about something. She can't do something about that. Okay, she
yeah,
can't be able to go back to the past, So, but
Yeah.
she's hoping something like that. So she cannot control her thinking, and but emotionally, the feelings has been damaged.
Yeah.
Okay, so once our feelings has been damaged, it will going to proceed to our brain. So the brain will going to process that one. So when there would be this particular processing that cannot be processed on her mind, so that would that would turn out to be a mental condition,
Yeah.
right?
And
Yeah.
it's a very stress
Yes.
to my member
Of
in
the
other
family.
member in the family, and
That's
sometimes
correct.
I feel I have symptom of mental
Oh.
disorder. Yeah, sometimes.
Oh
Um,
no, you should have. You shouldn't do that. You shouldn't think of that also. And why? Because you cannot help your sister if you were going to do the same, right? But
yeah,
it's normal. It's normal for us person to, because we are attached. Yeah, that's our family, right? So we are attached to them. But you all you have to think is what I have to do in order for me to help my sister. If you
yes.
want, you have
I
to
think a
take.
lot, and in Vietnam, I think
Mm,
the to add treatment after medication,
yes.
more further treatment, um, like some like any cure, any cures
Yeah.
to co with the patient. Um, is a nurse is still nurse development in Vietnam.
Oh, really?
So I this
Actually,
time.
actually, Anne, okay, I'm going to give you an advice. Okay, since you are already a doctor, it's easy for you to do that one. You have to take only masters. Okay, you need to take also a psychiatry course. It's just
Yeah.
maybe it's just 2 years. Okay, so in relation to your course already, since you are an ophthalmology, so you can also had this particular another what is one, um it's just only the so-called here in the Philippines. Actually, it's just only a specialization. Okay. So
the-
if you are a doctor, you need to specialize something, you just have to study. Maybe that's for only for 2 years. Okay. So you are an ophthalmologist, and at the same time, you are also a psychiatrist. That means
Mhm.
you are a doctor, a mental doctor. You can
Uh-huh.
do that. Do you have that one in Vietnam?
No. Uh,
Oh, sad to say.
uh, so sorry, but
Yeah.
have you any class at the at the time of?
No, actually, it's just only one. So you are just only my class today. Okay,
Yeah,
yeah. But what about you? Are you busy?
yeah, and maybe um because I am a ophthalmologist now, and if you want to become the psychologist,
Psychiatrist.
it it cannot.
Ah,
So what what I can. Oh,
you need to have two. You need to have two here in the Philippines, huh? And you need to have two specialization. Here in the Philippines, if you are, let's say, for example, if I am a doctor, I am a medical doctor, okay, MD, if I am an MD, then my specialization is pediatrician. So that's my first specialization. If I am going to specialize another one in a psychiatry, that's another specialization. So you need to have only a training or a course for that, Anne. So to
Yeah.
complete that course, you are going to have two specialization at the same time.
Yeah.
Mm,
But I think to become a psychologist is very difficult, and
no.
it's not comfortable for me because um
It's
I know
mind, actually. It's a
you know
mind.
the psychologist have to listen more and more
Yes. You need
the
to.
story that is very sadness and difficult to understand. The patient
Actually,
can
there would be a
do
lot
that.
of, especially you are going to study the nerves because sometimes the nerves has something to do with our mind. Okay, if there would only be something like a little disturbances. Okay, a little disturbances. Okay, there's something to do with our mind, and that disturbances. Okay, that would create. Okay, an imbalance of our not just only physical, but it can manifest to our mind.
Yeah.
Yes. So
Yes.
it's actually
You.
actually it's difficult. It's difficult, but okay, if your aim is to help your sister, you can do that.
Yeah. I um
I
I
don't know.
will
You do have a
let
lot. You
the
do have you do have psychiatrists also in Vietnam.
yes,
Oh,
yes,
yeah.
we have.
Mm.
And I so admire who who are psychologists because I think in a lot of special in medical
Yeah,
the psychologist is very difficult. I think
psychiatrist, okay?
yeah.
Yeah, psychologist is just only a graduate, okay, of having a what is one? Preparatory for psychiatry. So if you are going to take up psychology, so you need to study the mind, okay? But
Mm,
you are not called as a doctor yet, not unless you are going to proceed to psychiatry. So you need to study more again in order for you to become a doctor, in order for you to be called as psychiatrists. So
uh-huh.
psychiatrist is a doctor of mental illnesses. A
Yeah.
psychologist is just only a preparatory for medicine, studied about the mind, okay,
Mhm.
about the mind. But you cannot, you psychologist, you cannot cure, okay, you cannot prescribe a medicine if
Yeah.
you are just only a psychologist. You can talk, okay, you can conduct an investigation, you can conduct a diagnosis, but you cannot prescribe medication if you are a
Yeah.
psychologist. Then you need to seek for the help of the psychiatrist. So the psychiatrist will be the one to give the prescription.
Yeah.
Okay. I know you can do that, Anne. If I were you, since you are now a doctor, if I am a doctor, you know what? Okay, I have to specialize two things, Anne. First, okay, I have to specialize surgery, mind surgery. That's my
Agree.
aim. Yes, I need to become a surgeon of the mind. I like that one, but no school here in the Philippines offering that one. That's only in the United States.
Oh yeah.
Yeah. So in the Philippines, we don't have a school for surgeon of the mind. So it's just only in other country. So it's
Yes.
going to be
It's
very,
very difficult.
very, very, yeah, it's very expensive, right? Uh-huh.
Yeah.
Yeah, so that would be it. Now, okay, and so it's about time for us to say goodbye again. So take good
Yeah.
care of your sister.
Yeah.
Okay, so if you have
Uh,
time, you have to
let's
study.
let me check the 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 diagnostic the English uh, the name of the
Yeah,
diagnosis.
yeah,
Uh,
the
yes,
name of
like
diagnosis, huh? You have to tell me that, okay? so that we can talk about that on our next meeting. Oh, by tomorrow, okay? Okay. So thank you so much, Anne. Good night, and see you again tomorrow. Bye bye. Okay.
Bye.
Bye
See you.
bye. Bye bye.